Let me ask you, at what point did you, because we're talking years now that you were suffering, right? How many years altogether was this journey from the point that you started to feel all these symptoms and experience this pain to the point of resolution? How many years are we talking?
About 8.
Eight
I was I
years.
was I was bedridden, unable to talk, unable to chew, just confined to one room. I missed my son's entire childhood. He was 5 when it happened and 13 when I had the surgery. And then, of course, it's not like I just popped out of bed. There was a little bit of a recovery period. So, I missed quite a bit of everything.
I mean, 8 years is such a long, that's like a decade of a lifetime. That's like 10%, you could say, if you're going to live to 100, of one's life to be
Nice
suffering like that.
goal. Good job. 200. Let's shoot for that. I like that.
Absolutely. No, you gotta
Yeah.
aim high. But my point is, how many years into this are you kind of like, hey, you guys don't have answered? Like, where do
Right
at what
away.
point is that, inflection point of, I need to find something else because this isn't working
Early on,
early
uh,
on?
yes. Like I said, I was into alternative medicine, but I didn't find an answer. I mean, I couldn't research because I couldn't sit up at a computer. And, you know, my husband his background is mechanical engineering, so he wasn't going to figure it out. I had to figure it out, right? So um, when I was able to get an iPhone, which was about 2 or 3 years before I had the surgery, I was able to start doing some serious research.
So you
But
became
prior,
your own house MD and just started looking at all the literature and everything and going through it that way?
yes,
Yeah.
yeah. And I also learned to look at I'm willing to look at all research. In the absence of human research, I'll look at animal research. In the absence of animal research, I would look at good objective data. In the absence of good objective data, what are people saying subjectively about this herb, this treatment? Um, yes, I researched on every facet that you can imagine. And again, I was really blessed in that I had the background from CASE because it is a data driven institution, and I was taught how to read research literature and data and studies. And so that was helpful because when I got to about a year after I had my iPhone, I started having serious digestive problems. My gallbladder was not functioning well. I had, it was starting to give me pancreatitis. I was losing weight. I was so miserable. I cannot tell you how physically miserable I was because I had the headache from the toxins and all the pain here. And I would have neuralgia symptoms like funny little pains shooting in my eyes. And I started to have to research all of this stuff for my gallbladder and my pancreas. And I know more about the gallbladder and the pancreas than I ever wanted to. But that's what you have to do if no one is coming up with an answer for you. And so I had, even a year before I had my surgery for the root canal treated teeth and the cavitations, I was treating my gallbladder and my pancreas. And I had food allergy testing. I actually had someone come to the house and draw the blood for food sensitivity testing because I didn't want to go out. And I had a lot of food sensitivities, and there was a lot of food that I couldn't eat. I got rid of all of this. The only thing that I have now is I'm allergic to bananas and chocolate. So
That's a bummer.
that is a bummer, but compared to what it was, uh, I'll take that. That's fine. Um, I mean, there was hardly any grains that I could eat, even potatoes. I think I lived for a couple months on sweet potatoes and egg whites. And then I kept, expanding my diet. I used a 4-day food rotation diet until I was able to eat more foods. And I had done a pretty good job of surviving. I really was literally just on the edge of survival for that whole year until I had surgery. And I was doing a lot of alternative treatments for detox. I did Garrison therapy. For those who aren't familiar with that, it's a anti-cancer regimen or protocol that involves diet and supplements and
A
coffee
lot of
enemas.
juicing and
A
enemas.
lot of
Yeah.
juicing, yeah.
Yeah.
And when you do a coffee enema, that will increase your glutathione as transferase 500 times normal than what is in your bloodstream normally. And that glutathione is our master antioxidant. And so that would clear out a lot of toxins. So when I would do a coffee enema, I would be able to talk for a little bit.
Hmm.
My voice would get a little bit stronger. I'd feel a little bit better. I wouldn't feel as painful all over. And I was excited. I'm like, okay, so there's a toxin that's causing this. And that was, then of course I remembered when I was given the steroid, and that had made me worse. Because what did that do? That allowed all the infections to proliferate because there was nothing checking them. My immune system was being shut down from the steroids, and that allowed the infections to grow.